in the breakout room. And just wanted to welcome Lizzy Feliciano, who's the Chief Marketing Officer at Jvion, a clinical analytics company here. So welcome, Lizzy.
Hello, thank you for having me, AT.
Yeah, no, we're excited. So for the discussion today, we're going to touch on three areas. First, we'll just start with some of Lizzy's background and how she got into healthcare and some of her experiences before Jvion. And then we'll move into Jvion, some of what they do and where they see the future of analytics going. So they're doing a lot of interesting things in that space. And then we'll sort of wrap up with trends in healthcare or spaces Lizzy thinks are interesting in lessons learned there. So as we're going through, if you have questions, you can put them in the chat. And then at the end, we'll have some time for Q&A as well, where we'll go through some of those questions. So feel free to put them in the chat whenever, and we'll touch on those as we get to the end. Sound good?
Awesome.
All right. Well, first, let's just start, with Lizzy, just some of your background. How did you decide to even get into the healthcare space?
So I didn't. I was thinking about that, right? And I always tell the story. I actually grew up believing I was going to be the world's best criminal prosecutor. So I wanted to be an attorney. I was a political science major. But during my senior year in high school, I had taken a part-time job working for a company sort of on the border of healthcare. They did claims adjudication. And so I worked nights. And over the summer, between my freshman and sophomore year in college, I went full-time, and they asked me, they were kind of making their move into care management and had no marketing function. They needed help responding to an RFP, which at the time I didn't even know what it was about. Like, what's an RFP? I don't understand this. I wasn't a marketer. And they said, can you help? And I said, yes. And that literally was the last time I ever thought about doing anything that wasn't somehow associated with healthcare. And since then, it was just sort of like an organic progression. Every company that I ended up, entertaining was one that was somehow, in the analytics space related to healthcare. So it was pretty organic that way.
Very cool. So what was it as you first started dipping your foot in healthcare that made you say, man, I really want to keep going in healthcare, or these keep sounding interesting, versus like, man, I want to stay away from that space?
I think with healthcare, it was just the personal connection, right? There are industries that, I guess every industry touches you in one way, shape, or another. But for me, when I started working with these analytic companies that were really trying to impact the way patients were receiving care, right? For me, it became like a very personal mission where I thought anything that we can do to make sure that people are getting the right treatment at the right time, that we are being proactive, even from a cost perspective, having lived through, episodes in my life where the expenditure from my own health was so high, anything that we could do to drive that down, it just became a very personal thing for me. And so I appreciated what all of these different organizations were trying to do in those areas. And it just, the more I learned, the more intrigued I was with, all the different facets, right? The regulatory side of healthcare, the privacy side of healthcare, there's the care delivery side. There's just so many different elements within that umbrella that any progress and any innovation can just, generate such great improvements. So it was interesting enough and a personal, connection for me that kept me here, not wanting to look at any other industry, at least up until this point.
Yeah, very cool. So I know you've been involved in, several startups at different stages, and we'll touch on Jvion later in a minute, but I know two of the ones you worked with, a company called MedAI out of Orlando, and then, at LexisNexis, more of a startup within a bigger company. So maybe let's start with the MedAI side. Maybe just tell folks a little about what they did and how you got involved and what you worked on there.
Yeah, absolutely. So MedAI was my first real experience with a startup, and it was an amazingly interesting opportunity. So the founder was a respiratory therapist. That was his career. He then became an educator, and he was obsessed with Star Wars, no lie. And so his obsession was, how is it that we can launch missiles, send satellites, into space and have them orbit around a very specific trajectory. We can launch missiles thousands of miles and they hit their target. How can we do all of those things? But we can't look at a patient and understand where their health is going. And so he decided, to get together with some of his colleagues and build a company that really focused on predictive analytics. They were truly a pioneer. This was more than 25 years ago. And so they were truly focused on building models that could help identify where a patient's health was headed within the next 12 months. And it was new for the industry. And so there was a lot of personal passion. It started just based on him wanting to answer some questions around why can't we do this in healthcare? And so that was really interesting to be around sort of that energy. Then you kind of transition to Lexis, and you're familiar with Lexis, but that was a different feeling because this was a startup. LexisNexis Healthcare was a startup within a global company. So the dynamic was very different, right? LexisNexis Healthcare started as almost like a business hypothesis where MedAI started based off of like a passion project. So that's kind of the two flavors, right? So at LN, they were really interested in taking their existing assets. They're known for just a vast amount of data that they have access to. They had been doing a lot in the fraud space for other industries like retail and banking and real estate. And they thought, what if we applied this to healthcare, right? Fraud is a big kind of bucket of waste in healthcare. And so they wanted to just sort of pivot their existing business use cases to the industry. So it was a different sell because the passion wasn't there initially. And so we had to spend, the first few years really selling our hypothesis to the larger organization. And so kind of the work was different. With MedAI, it was really passion is there. Now we just have to get people to believe what we're doing from a user perspective. In Lexis, it was like, we just need to make sure that all the business leaders believe that this is going to generate revenue. It was a kind of a slightly different flavor in terms of what we focused on, but both were amazing experiences.
Yeah, very cool. I want to dive into those each a little bit more here. You're on the MedAI side. I love how you said it started sort of a passion project. I think that's one of the things I see that makes entrepreneurs successful is the ones who are truly passionate about the space or the problem they're trying to solve. So let's dive into the fact that you were talking about, hey, with the analytics, right? You're wondering why has this not been done? Why can't you predict where direction people are going to help intervene with care and stuff? Tell me about the challenges of, on the analytics side, proving that you actually can be correct predicting things like that, as well as on the selling side, convincing providers and patients and others that this makes sense to do.
I mean, look, there's no one answer. I think healthcare's biggest challenge is the lack of interoperability. Let's just start there. Patient data is so siloed even today, despite the EHRs coming in and trying to create an environment where all of that documentation is maintained. The reality is that there are hospitals, hospital systems that have a hospital 2 counties away and they can't even talk to each other. So from an analytic perspective, that is probably the biggest challenge, is getting access to a really holistic view of a patient's medical care journey. That's a challenge. Now, once you get that, I think it takes time to build algorithms and data science and to be able to understand how that data plays, how it interacts. One of the things, and I know we'll talk about Jvion later, but one of the things that really excites me about Jvion is we say from the very beginning, look, data in and of itself is not valuable because not all data influences a health outcome, right? So your data science has to be able to allow data to interact organically so that the relevant interactions can surface, and then you can correlate that to an outcome. So I think from an analytics perspective, right, data is still a challenge. Getting systems to talk to each other, getting healthcare organizations to have IT resources that are available, right, to be able to extract that information. I think that's critical. But once you do that, then I think it really takes, especially for startups, you have to be willing to accept that not everyone believes your stuff works. And I say that because often we just want to say, we've got the best data scientists and deploy us and you're going to see miracles. But for us, we spend a lot of time educating the market. We spend a lot of time, we have an amazing implementation team, value attainment team. We spend the time upfront sitting with the customer, making sure that we can articulate what their objectives are, what does success look like for them, and then mapping that to what we're working on for them. Once that's done, we still spend time making sure, do you understand the insights that you're getting? How can we help you operationalize this? Is it in the right place within your workflow? There's a lot of that goes into building the credibility around your analytics. And then of course, those relationships are the ones that result in published case studies and peer-reviewed journal articles. And Jvion spends a lot of time on that in particular. But that's how you build it, right? That's almost like the essence of building a brand. Is it takes time. You got to educate the market. You got to make sure that they understand how to deploy what you're delivering, and then you've got to kind of encourage them to talk about it. Mm-hmm. And across analytics and healthcare, I think that's a pretty standard formula.
Yeah. Well, I love what you said there about, applying the analytics to specific outcomes or specific decisions or in the workflow. Because, one of the things that I see across healthcare, but other industries as well, is a lot of entrepreneurs focus on, I've got this really cool algorithm or this really interesting thing, or I can make these really cool graphs. And it really is just that at the end of the day. It's just interesting. It doesn't actually affect anything directly. And so the more you can tie your analytics to something directly, I think there's a lot of power in that.
Yeah.
You start talking about Jvion. So let's maybe transition, to that a little bit. First, just maybe give folks who are unfamiliar with Jvion, what does Jvion do?
So Jvion has been around for over a decade now, and they our positioning has shifted over the last few years, but we really classify ourselves as a prescriptive intelligence company that applies clinical AI to help healthcare organizations better manage populations and identify rising risk. So the best way for us to kind of wrap people's brains around what we do is, traditionally, risk is a big problem in healthcare from a health outcome standpoint. Preventing avoidable harm is a big problem. Like, do no harm is a core tenet of healthcare. But 1 in 10 patients experience harm during the course of their medical care, and more than 50% of those incidents could have been prevented if they would have seen it coming. And so it's the did you see it coming aspect where we have really honed our expertise over the last 10 years. The traditional way of addressing that is to deploy a predictive analytic or an algorithm to identify risk. That's where that stops. And that's why we've seen very limited success, if you will, using those traditional approaches. What Jvion does is we focus on what we classify as the modifiable aspect of risk. Not all risk can be avoided. We know that patients, right, their trajectories are going to be changing and evolving as different elements of their life, come into play. And so what we focus on is, what are those things that we can address that are directly influencing this path that they're on towards a negative outcome? And then we tie those risk factors to evidence-based clinical guidance. So we're not just identifying the who, and we're not even just identifying the why, but we're then helping the clinicians understand the what do you do about it. And we deploy that across, inpatient, community, health plan settings. So we've got our solutions in a multitude of different healthcare organizations today.
Great. Lots of follow-up questions to dive in there on the brand and the strategy and the analytics and the type of customers. But maybe let's start with one of the things you said around, hey, this message has evolved over the years. Tell us a little bit about how the strategy and focus of Jvion has evolved over the years.
Yeah, so when I think about when the company first started 10 years ago, the founders were really focused on helping clinicians and nurses in the hospital setting understand if the patients that they were caring for in the moment were on a path, right, to a negative outcome, whether that was developing sepsis or a pressure injury. And so they really wanted to help clinicians make decisions in the care setting. But as the regulatory environment has changed, population health, value-based care, all of these different care models and principles and frameworks have been rolled out, it really has become more important to be able to understand how a patient's health is going to change over time. And so that just naturally kind of allowed us to grow our message to say, well, we used to just predict what was going to happen to a person within the next 4 hours, but now we're looking out 1 year, 2 years, to be able to help them sort of manage health longitudinally. And so that has naturally just forced our message and our position to evolve, to be able to speak to where the landscape is today.
Yeah, and another thing you mentioned there around communicating that message is that as we know, healthcare is very complex with many different stakeholders between the patients, the providers, the physicians, the hospitals, the pharma, all different folks. How does Jvion? How do you think about how you navigate piecing all those together in a way that gives value and connects those two or those sources together?
So we currently, we're in all of those spaces. We sell into all of those markets. We don't sell into the consumer space of healthcare, right? So we don't have anything that's patient facing. So our primary would be the provider and like the health plan segment. When we're thinking about how we align to those segments, there's a lot of things that we consider, but I think the first thing is, does the challenge that we're trying to solve align with our mission? And our mission is prevent avoidable harm, right? So that's number one. Number two is what we're able to deliver truly impacting the lives of patients? That is ultimately our goal with all of our products and solutions. And can we deploy what we've spent 10 years building against that challenge or the problem they're trying to solve? So I think from a startup perspective, it's really easy when you're trying to remain relevant. I mean, healthcare analytics is a very saturated and competitive space. You could very easily get caught up in this, I'm going to try to be everything to everyone and do everything poorly. And so for us, when we're aligning ourselves, it's yes, we align ourselves to the market, but we're also aligning ourselves to specific problems that connect or circle back to our mission and to our core capabilities. And I think that's important to kind of keep as that filter. Otherwise, you can end up spreading yourself too thin and just not doing anything well. And then even what you do well becomes less interesting to the marketplace.
Oh, so many great nuggets in there, Lizzy, right? Of like, I love the aligning to that mission or vision that helps guide your decisions, right? That, as an entrepreneur, right, there's always the next shiny thing to go chase. And yeah, I see more success from folks who focus very narrowly to begin with and ultimately build up to the bigger vision than like go shoot all over the place and end up with nothing.
And that's uncomfortable. I mean, right. Speaking frankly, it's not easy as a business who's really trying to make a name for itself to say no. And there are times when that's just necessary because it dilutes, right, what you do well. And ultimately that will catch up with you. And so, just having the ability to understand what the identity of your company is, to understand what your core capabilities are, and to be willing to say no to things that are off mission, off purpose. I think that's an important thing that, hard to do, but critical to long-term success.
Great lesson there. Everybody's taking notes on that one. I love that. So Lizzy, being on the marketing side of things, as we talk about the message evolving and the different stakeholders, as sort of the leader of the marketing there, how do you as a marketer in healthcare manage the brand, the message, and many of those things? I mean,
I'm sure there's tons of marketers on the Zoom meeting today. It's an exciting function. I think for a long time, marketing has been categorized almost as a support function versus like a core business work stream. And what I have always tried to do in any organization where I'm able to lead the marketing function is to really guide the senior leaders to understand that, look, marketing is probably engaging with the existing and new markets before the sales teams are, right? Before the business stakeholders are even talking to a prospect. We've seen them, we've messaged to them, we've engaged them. And so marketing could be a really valuable intelligence hub that can be used not only to help clearly identify the brand and build the brand, but to also guide strategy. What are the messages that are resonating? Who are the competitors that are getting more visibility or share of voice? What are the channels where we're able to connect with, the buyers that are truly holding the decision-making power? And so as a marketer, you can't just focus on a brand or a message, but you really need to kind of step back and say, how do all of those pieces help build on the business strategy that's in flight? So you have to build a really strong team. You have to make sure that you're up to date with where your market is. Where are they going to get information? How are they engaging with content? What kind of content? We live in the Twitter world where, like, if it's more than 120 characters, people zone out. So publishing 10-page white papers is not the way to go. Right now, from a sales perspective, the biggest challenge that at least we see is getting people on the phone, because guess what? They're not in their office. So how many of us have cell phones for those key prospects and targets? And those are things that you don't really think about until you have to think about them. But as a marketer, your job is to really start thinking ahead and thinking about the barriers that are coming down the path that you're going to have to overcome so that you don't lose sight, right? And you don't lose that connection with your market.
I love that sort of marketing as not just a back office function, but driving in sync with sales and setting the strategy. It really makes a difference there. So one question, Lizzy, for a lot of the entrepreneurs here, right, that they're trying to figure out their brand and their message and, don't have as much traction. Any advice or words of wisdom on when you're early on and you're trying to figure out that brand and messaging? How do you test some of those things and start to hone in on, hey, this is the message I want to take to market?
So, information is power. And I think that at the expense of, well, hopefully I'm not alienating anyone that might work for an agency, but here's what I think. I think that in my experience, I've come into companies trying to build a brand that will go out and hire an agency and spend tens of thousands of dollars paying someone that's not connected to your mission or your vision to go out and do research and then come back and tell you how you should build your brand. And I think that for a company that is just starting, probably not the best thing to do. I think the investment needs to be in bringing someone in-house that can rally around who your company is and has the ability to aggregate sort of all of that intelligence. You have to look at your competitive set. You have to know who your competitors are. You have to utilize all of the contacts that you have in your network. I'd rather get on a phone with someone the CEO knows and say, can we just have a frank conversation? Like, when I say this, what does that bring up for you? That is where you're going to get the most valuable nuggets in terms of where your messaging needs to go. Surveys are a good, kind of foundational data point to pull in. Social media is probably the fastest way, right, to get to as many people as you can. Throw out polling questions on your LinkedIn company pages, asking questions that get to the heart of what you're trying to position your company around. You have to do that consistently. You have to talk to people that are familiar with your market, with your industry. And you have to know that building a brand can take, upwards of 5+ years. So you're not going to get this right year one, and you have to be okay with that. But I think that knowing fundamentally what the mission for the company is, like the essence of the company has to be established. And then you just sort of pivot that mission based on how the market and your customers and your targets evolve. I don't know if I was clear enough, but I think there's so many ways, right? There's so many digital avenues. But the best thing is bring someone in-house that is vested in your company's mission and vision, and have them lead that work, because you will never get the same level of insight from someone that is three steps removed from your company.
Yeah, no, that makes sense. Couple minutes left here, and then we'll open, we'll do some Q&A. So if you have questions, I see a couple have already come in, continue to put more questions in the chat. We'll get to those in a few minutes. But Lizzy, you can talk about analytics and the evolution of analytics over time. How do you see analytics in healthcare continuing to evolve over the next 5 to 10 years?
That's a loaded question, AT. That's a loaded question. And, one of the things that we are seeing come up is, so first of all, COVID changed everything, right? We all have COVID fatigue, like talk COVID. COVID changed everything in healthcare. And now more than ever, we have got to find ways to get healthcare to people where they are. And there's a lot of things that play into that, like health equity, right? There's a lot of socioeconomic barriers that are driving, lack of access to care today that weren't there prior to COVID. So there's this whole concept of the home is the new hospital, care where you want it, when you want it, how you want it, remote patient monitoring. People are, being driven to telehealth and virtual care settings. And so analytics have got to very quickly figure out, are they pulling in these new data points? Are they able to understand what's happening in these remote environments to drive, meaningful insights back to the providers, right? To be able to inform health plans that are building out programs. That's really important right now. And I think that the analytic industry that's really what's consuming our time, is saying, how can we keep up with all of these new care models where people are not coming in, I'm not seeing them face to face, they're not necessarily checking a form, I'm having to pull data from different places and make sense of it. More importantly, they're now getting care in their natural environment. Do I understand what the influencers in that environment are? And that's critical, right? That's all the rage now as well, socioeconomic data, social determinants, health equity. That's a huge thing that analytics has to solve for.
Yeah. Well, like you said, getting them the care where they need it in home with all the mental health challenges. I know it's a space you're passionate about. Like, how do we continue to use analytics and things to help support folks that may not be reaching out for care or could use that?
Yeah.
Last question here, and then I'll open it up. There's some questions in the Q&A, but just, Lizzy, take a step back from all this, your experiences at MedAI and LN and Jvion and many other places. Any sort of lessons learned that we haven't really touched on yet to any of the founders or entrepreneurs here of things to do or things not to do based on what you've learned over the years?
So glad you asked. We've been having these, I have these conversations every day internally with our leadership team. But there's probably 3 things that, if you take away or you remember, it would be these 3. One is, there is a balance between business sense and passion. Too much of either one can drive your business to a dead end. So I think just keeping that balance. You want people that have the passion and the vision for the business, but you also need that guidance from a business standpoint. So there's a balance there that needs to be struck. Probably the second and maybe the most important is culture eats strategy for breakfast. I always say that. So, we could be so focused on building a business that we forget the importance of building a culture. And that is critical because your culture will drive your success in the long run, right? It's the people that you're bringing in. It's the character of your employees and your decisions. That is critical. And you can have the best strategy in the world, but if you have a broken culture, it will prevent you from moving forward. So don't ever underestimate the importance of building culture. And then the third one is probably what I said earlier, which is just remember, you can't be everything to everyone. And so make sure that you're clear on what the essence of your organization and your mission is, and use that as a filter through which your opportunities, right, are run through.
Yeah, well, great lessons learned there. To sum up, Lizzy, really appreciate you taking the time for that. JC, I'll bring you back on. I know there's been some questions in the chat, and if others have others, feel free to put them in the chat now. JC, you want to come on and go through a few of the chat questions?
Yeah, absolutely. Lizzy, thank you so much. What a treat to just hear so many things. So thank you. I'm trying to kind of shift through here. One thing was, a question is like, how is the analytics space in general? Like, are there a lot of companies out there developing analytics? Are you one of the only ones? Like, maybe you could kind of speak to the whole industry. Are y'all fighting just to be the one only out there? Like, what does the customer need? It sounds like it's a great need, but that was kind of one of the questions. Do you have insight there?
Yeah, I mean, that's a pretty broad question. I'm sorry, our alarm is going off. So I think analytics is definitely a big topic in healthcare or in any industry. The type of analytic that's being developed really depends on the customer and what they're trying to solve. We are, classifying ourselves. We use AI as a means to an end to drive prescriptive intelligence, right, for our customers. So at the end of the day, what is the customer trying to accomplish? Here's what I will tell you about the analytics space. In healthcare specifically, customers, providers, for example, hospitals, health systems, they've spent millions of dollars implementing platforms. And so these are like EHRs, for example. And what they're doing now, especially post-COVID, is trying to understand, I've already invested millions of dollars in this platform. Can I get everything that I need out of this one investment? And so from a competitive standpoint, an analytics company really has to be clear on how they differentiate from those platforms where millions of dollars have been poured into. But the analytics can solve different problems, right? We're trying to connect rising risk with clinical-based guidance and evidence-based guidance. There are analytics out there that are trying to identify what the best communication channels are to engage a patient. So I think, what analytics are being built? All kinds, because there's a lot of problems that are trying to be solved. I think where we really start to see an impact is when companies can come together. And I didn't touch on this, but it's important. There's a really massive healthcare partner ecosystem that can benefit from more collaboration. And so I think it's okay to build your analytics, but don't necessarily try to be the sole solution. I think there's a lot of room for analytic vendors to partner and have a greater impact.
Lizzy, one follow-up question on that, just for folks, there's many buzzwords in healthcare, right? And there's bunch of folks that claim to be analytics companies, AI, ML, blockchain, pick your buzzword. What's your advice to folks who try and brand themselves that way versus being more specific to the problems they're solving and what they do?
Yeah, I mean, the one thing I did at Jvion is, look, AI is a means to an end. That should not define your brand, right? You're just using that as a vehicle to get to an outcome or to solve a problem. So don't brand your company based on the technology that you use. Brand yourself in terms of how can you solve the problem uniquely? What's the outcome that you drive? And you happen to drive that result because you use that technology. I think that's the biggest challenge for companies in the analytics and technology space, is we always want to brand the widget, but the widget can become very commoditized. And what you really miss is what it is that you're delivering, right, to the end user and uniquely. What's the power of the result that widget allows you to arrive at? And too often we forget about that in our messaging.
No, absolutely. Absolutely. Lizzy, one other thing that I know you mentioned a couple of times was the social determinants of health and socioeconomic stuff. Maybe just quick 30-second over for any folks who are missing what that is, just what that is and why it's important in healthcare.
Yeah, I mean, social determinant. So what the stats, and you could Google this and find this easily, anywhere, but it says that, more than 60% of our health outcomes are not driven by our clinical condition or the care that we get within the care setting. It's really influenced by factors, the behavioral, socioeconomic factors outside. So where you live, where you work, education, income, access to nutritional meals. So when you talk about social determinants of health, you're talking about the non-clinical facts of life, right? And these are the things that we take for granted. But all of those things have a greater influence on your health outcome than even the medications that you're on. And it sounds kind of counterintuitive, but that is what research has shown. And so healthcare has traditionally focused on just the clinical, right? What do I know about your disease, your diagnosis, the medications that you're on? And we've found now over the last 10 plus years that really understanding, air quality. We've done a lot of research here at Jvion around environmental hazards. How does air quality affect your health outcomes? The particles in the water in the areas that you're in, access to food, right? You could live in an area during COVID, we saw this, and I'll be quick because I know we're at time, but we saw where a local grocery store shut down. And so suddenly that area becomes what they call a food desert. But I have the ability to order, Instacart, and I can order Amazon Fresh. So I had no problem bringing nutritional meals into my home, but my neighbor did. So that particular incident affected my neighbor differently than it did to me. And I think that's the sort of insights that we're starting to pull in to better understand how it impacts and influences health.
Great story there, and very exciting times for healthcare and continuing to improve, across the population and deliver meaningful outcomes. So I know we're coming up on time here, but Lizzy, wanted to thank you again. Really appreciate you taking the time. So many great insights there around, focusing the mission and vision, and saying no to certain things. And I love the culture eat strategy for breakfast is among many great lessons. So thank you so much for joining. Thank you everybody else for joining as well. And then we've got some upcoming events here. We have our next Atlanta Startup Convos meeting on September 1st. A couple early stage startups presenting what they're working on. Then we've got our next Atlanta Healthcare Entrepreneur Meetup on September 29th with Bill and Andy from Auver Healthcare Company in the Tech Village, just doing some great things around value-based care. All right, with that, everybody have a good day. Thanks for joining. Really appreciate you coming out this morning.
Great. Thank you.